Basically, the care homes, this is the big question mark. They have no idea how they were so badly affected. You talked about the Prime Minister. We've heard from Anders Tegnell, who's the state epidemiologist. I just spoke to the Swedish Foreign Minister today, and she also admitted that this is the big failure of Sweden. They were not planning on this amount of deaths to happen here in Sweden. And because of this is what they're saying, that this is why we have so many deaths here in Sweden compared to the other Nordic countries. They're also making the comparisons between the number of people who live in Sweden, how much the disease has progressed in the country. But basically the nursing homes, that is the big question, how they ended up with all these this high number of deaths here in Sweden. There are a couple of factors here to remember. Basically, people working in nursing homes in Sweden, they don't have the exact same education as people working in hospitals. There are a lot of people who are sort of coming in and out of these jobs. They suspect that people have entered their jobs without having proper medical training, but without having proper protective gear. They also think that they've moved between patients who might have been infected and those who have not. So there are several things here that might have been going on. But, this is a question that needs to be researched over the next coming months or years, how so many people in Sweden ended up being dead in nursing homes.
Several serious issues at play here, and also accusations that care home residents didn't actually even get the medical support they needed. What's the substance to those claims?
Well, actually, here in Stockholm, where I'm at currently, there's actually a directive from the Stockholm government saying that if you come down with COVID-19 here in Stockholm, if you're in a care home and if you're older, then they usually don't transport you to hospital. Instead, they take care of you at that nursing home and then just pretty much hope for the best. I just spoke to, just a few minutes ago, to a young couple who lost an uncle, and they said that they called the government, they called the local authority, they called the nursing home and begged them to send him to hospital, and they just declined, saying, no, we're going to put him in care for terminally ill people who are sort of at the end of their lives, and they begged them, please take him to hospital, but they didn't. Instead, 6 days later, he was dead. So yes, there are some substance to those claims that people are just not getting the sort of advanced medical treatment that they could receive in hospitals because they just stay in the nursing homes. Now today they announced more testing to be done here in Sweden, so that's something they hope is going to sort of turn the curve to knock down the number of deaths and people coming down with COVID-19 in elderly homes.